Yeah, I think the highlight of the ASCO is probably definitely in the biliary tract or hepatobiliary in HCC and cholangiocarcinoma. I would say that if there are potentially practice-changing presentation abstract that was presented at ASCO, one would be a TOPAZ study, probably. As you guys know, TOPAZ study is a phase 3 study using immunotherapy with combination chemotherapy with Durvalumab in combination with gemcis in advanced biliary tract tumor. So the schema of the study was very straightforward. It was a phase 3 study, randomizing to gemcis durva versus gemcis alone for 6 months, followed by maintenance durva or placebo. The primary endpoint of the study was overall survival, and the secondary was PFS and response rate. Immunotherapy as a single agent in cholangiocarcinoma is very modest at best. If you look at the single agent data with whether it's Pembro or Durvalumab, it's probably hovering around maybe 10% at best in refractory setting. So obviously this trial is trying to combine with chemotherapy to see if there's synergistic activity with the combination. And the trial did meet the endpoint. There was an improvement in overall survival. Granted, it was a little bit less than 2 months. There was an improvement in PFS along with improvement in response rate. So clearly, at the first interim analysis, the trial was positive, and that's the presentation that Dr. O did at ASCO. So I think this will be a practice changing. One could argue sort of the modest benefit of adding immunotherapy to chemotherapy in terms of the number wise. But if you look at the coattail of the Kaplan Myer curve, I think that's where the immunotherapy really benefits, is that they're more long-term survivor with the combination of IO than just chemo alone. And I think that's the key. The second key point here is that if you look at the adverse events, there was not much additional toxicity when you add Durva to gemcis. So I think that's another key too, that you're not adding much toxicity when you add Durva to chemo, but yeah, you're getting some benefit. Once again, if you look at the median number, that's very modest at best. However, if you look at the long-term Kaplan Myer curve at the coattail, there's definitely advantage to adding Durva. Other sort of controversy about this trial is that if you look at the Kaplan Myer curve, the median survival sort of starts separate after 6 months. So remember, at the 6 months, that's when half the group continues on Durva alone, or half just get placebo. So one could argue that is this a more of a benefit of a maintenance Durva versus a combination? So that question still has yet to be an answer, but at least there's improvement in PFS and improvement in response rate. So I think based on the TOPAZ study, there will be a change of our practice in the future, where we would probably start adding a Durva to chemotherapy. I think the future is that we need to find a better biomarker that could really detect who will benefit more from the combination than the chemo alone.